This analysis is actually a case series of a few patients that we were treated at one center in Cologne at our university hospital. The aim of this analysis was to retrospectively look on patients who had received allogeneic stem cell transplantation for their CLL and subsequently had received Venetoclax due to a failure or a relapse after allogeneic stem cell transplantation. Now, this is an important question because all of the pivotal clinical trials on Venetoclax have always specifically excluded patients who had received allogeneic stem cell transplantation. So there are really no published data on patients in this setting. And we were happy to see that within these small case series, all patients had responded to Venetoclax in combination with a CD20 antibody. These patients were treated individually, so this was not within a clinical trial, and we did see very different outcomes. So while we saw a response in all patients, some patients just responded for 6 months, others are still ongoing with and responding to therapy and taking Venetoclax. And we saw that in individual cases, we even continued the ramp up of Venetoclax Obinutuzumab instead of the 400 milligrams, which is in label of up to 800 or even 1,200 milligrams. These are just single cases, and this is not standard practice, but in these cases we were able to induce remissions in these patients, even in patients who had received Venetoclax before allogeneic stem cell transplantation. So these are really just anecdotes, but we felt that it is important to know that Venetoclax seems to also have efficacy in patients after stem cell transplantation, and one should consider that when one treats a patient who has a relapse after stem cell transplantation.